These lines are
Good evening, everyone. So today's topic is about the cornea. And in cornea also, we are going to talk about corneal infection. Before talking about cornea, we should know exactly where is cornea exactly situated and how it looks. So in this, you can see the anatomy, where you can see in surface anatomy, you will see this black part. This is a cornea. Actually, this looks black, but actually it is transparent. Whatever black or brown or blue color of the eyes are seen only because of the iris. So actually it's a transparent structure. If you see surgery section also, this part, junction of the cornea and sclera. Here, from here to here, this is cornea, anterior part. This is a transparent structure. Here also you will have idea about. This is a eyeball, you can see here, right? So in front, if you see the cornea is this one. The side, from side, you will see it's a convex anterior. It's a transparent structure. And especially cornea is avascular. There are no blood vessels, and because of that, it is transparent. And there are no, the corneal nerves also, they are not having any sheathing around the nerves. And it is supposed to be most sensitive part in our body. So here we are going to talk about corneal infection, exactly how it occurs. Well, this cornea, you can see this is exposed, when the lids are open, it is exposed. So this corneal infection comes from exogenous, that means from the outer side. It can come from the air, some dust particles, some foreign body. And those who wear contact lenses, even those people also can have corneal infection. It's quite common. And even from the surrounding structures, like if there is a scleritis at the limbal area, also can lead to corneal infection, known as a keratitis or inflammation of the cornea. And structures just behind that, like iris, if there is a severe iridocyclitis, also there are changes in the endothelium of the cornea. So this is regarding your corneal infection, how it occurs. And the most common infection, if you see, is a bacterial. Bacterial infection is quite common in cornea. Like gram-positive, gram-negative organisms also can lead to infection. And viral infection. All this comes from atmosphere. And fungus infection. Usually in fungus infection, it is usually history of injuries there. And that also injury with vegetables. Those who work on the fields can have fungal infection of the cornea. And especially fungal infection is very difficult to treat. Many times with all the antifungal eye drops also, the fungus just remains in the cornea and the patient has to go for a surgery like corneal transplant. Now, before that, I would like to, this is about the infection. Non-infectious keratitis is usually some injury with the foreign body. The foreign body should not have any organisms. And allergic type of infection, like for example, if there's severe allergic conjunctivitis also can lead to some keratitis in the limbal area. chemicals, history of chemicals also can lead to keratitis. Dryness also can lead to keratitis. These are non-infectious. Now, what are the symptoms of corneal infection? Most common symptom is there's usually redness. Usually the redness is around the limbal area. There's a pain, severe pain, swelling of the lids. If infection is in the center, there will be blurring of the vision, photophobia, watering, and discharge. Usually in bacterial, usually it's a yellowish white discharge. While in case of viral infection, the discharge is usually watery. And there is lots of photophobia. The redness is also a little less than the bacterial. Lid edema is also less. Compared to bacterial, viral has got less symptoms, but it's more of a watering, and photophobia is quite common. While in case of fungal infection, usually the symptoms, if you see, they are not much. But when you see the signs are more. So only by examination, only we come to know this may be fungal or bacterial or viral, because everything is different morphologically on the cornea. So exactly to find out whether it's what type of infection, then you have to just take a scraping of the cornea is to be done and send for microbiology. Then we'll be able to know exactly what is it a bacterial or it is a fungal. Viral, it is difficult to find out. Only from the morphological way we can find out. Now, what are the complications? So now this fungal infection or bacterial, whatever is there, with the treatment, if it is not getting cured, then there'll be the infection will increase. The size of the infection also will increase. There'll be blurring of the vision. And with all the allopathy line of treatment also, if it is not getting cured, you have to go for surgery, therapeutic keratoplasty. That's a corneal grafting. We have to do. With corneal grafting also, the results are not good. Only it's a therapeutic. Again, we might have to go for keratoplasty for a optical purpose. So these are the way corneal infection occurs. And in case of allopathy, antibiotics, antifungal, antiviral things are there. But main important with all the drugs, if your immunity is not good, this antibiotics, antifungal doesn't really work and doesn't get cured. So you have to think of how to increase the immunity of a person. This is very important. So now Dr. Gaurang will talk about immunity part of it and all infections along with allopathy, or reduce the allopathy drug and continue with the homeopathy treatment.
All right. So thank you, Dr. Pushpa, for sharing your experience on ophthalmology. And we want to talk a little bit about holistic homeopathic approach towards such kind of corneal related diseases and infections in general. Homeopathy basically really works at a deeper level, builds the immune system. And especially a very artistic homeopath will really go in depth. And take the case in depth and find the most peculiar symptoms in the case, understand the state of mind, the entire patterns, the past history, and all details, and then find a remedy that can really help. And not just that, he will even try to find what are the obstacles in recovery, in healing. So that's the idea in homeopathy. So homeopathic medicine really go at a deeper level and build immune system. And that's what we can do in homeopathy. There are some amazing remedies here in homeopathy that can work on the cornea, on the eye, on the immune system, and help heal from within. So this is all that I want to say today, that take the most benefits of holistic health, of homeopathy, of healthy nutrition, of healthy lifestyle. And together it can really help a lot of ophthalmic condition. Depending on the disease, we can stop the progress of disease in in most cases, and in some cases, we can even help in reversal depending on the prognosis of the case. So you can write to us. We have a clinic here in Mumbai, and you can write to us, either come in person, take the appointment, or we can even have an online appointment wherever you are across the globe. Thank you, and namaste.